The topic of this video will be how to effectively treat carpal tunnel syndrome by only addressing the forearm and wrist. I cover the following: definition of carpal tunnel syndrome, history data points of carpal tunnel syndrome caused by the forearm and wrist, how to decide where to begin successful treatment, treatment explanation and demonstrations of manual and instrument-based treatments of a common cause of carpal tunnel syndrome coming directly from the forearm and wrist. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the PEAK method and the founder of the soft tissue treatment revolution, where we teach overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help a hell of a lot more people get out of pain. All right, so let's get right into it. Clinical case management for carpal tunnel syndrome, treating just the forearm and wrist. I did make a video about carpal tunnel syndrome treatment specifically for the neck and the shoulder. If you haven't watched that one yet, I'll link it up top here if you're watching on YouTube. Anywhere else, it'll be written down below in the description box below, but that gives you an idea of figuring out where to go and where to start, because if we don't know where the problem is in the first place, we sure as hell can't fix it. So let's get right into it. So let's just start with a definition of carpal tunnel syndrome. Carpal tunnel syndrome is a common condition that causes numbness, tingling, and pain in the hand and the forearm. The condition occurs when one of the major nerves to the hand, the median nerve, is squeezed or compressed as it travels through the wrist. In most patients, carpal tunnel syndrome gets worse over time. A couple things with this definition I don't like. I never like calling anything syndrome, but that's just the buzzword of what we are and what we have in this medical definition. The problem with syndrome is it doesn't really tell us exactly where the problem is. It's kind of like a junk box diagnosis and doesn't really get to the root cause and the tissue specific problem. Yes, it is a median nerve problem, but we also need to know where it is getting entrapped and where it's occurring, because a lot of times people just go after the effects of the entrapment, but they don't get to the root cause of what's going on. And that's why treatments are not successful and people don't get long lasting results. So a couple history questions that we do want to know when we're addressing carpal tunnel is, number one, is we want to know, where do they feel the pain? And it really follows a very predictable route. You know, it's going to be in the right in here through the carpal tunnel, in through here in the middle finger, the ring finger, the pointer finger as well. They might even have some pain in the medial part of the forearm, right in through there as well. And it's going to be that numbness, aching, burning, tension type of pain. Also want to know, like, what makes the pain worse. A lot of times if they use it too much, maybe they're having a job where they're using it too much, that tells me something. I want to see something is increasing that pain and discomfort, because it tells me more and more that it's a deeper rooted soft tissue entrapment of scar tissue to the nerve that we can address with a manual based and instrument based type of treatment. Also want to know, is there anything they can do to limit the pain a little bit? Maybe if they do a stretch, maybe if they ice it, maybe if they wear a brace. I always want to see those type of factors and understanding if this is actually a problem that we can address conservatively with manual based treatments. Also want to know any history of trauma to the elbow or wrist. Want to know what they do for recreation or activity. And lastly, what they do for work. I teach this a lot, a whole in-depth consultation and history taking problem solving, where you go through, ask a bunch of questions to get an idea of what's going on. Because I say all the time, if you don't know what the problem is in the first place, you sure as hell can't fix it. So what are the most important factor to decide where to start treatment? You know, I covered in the other video, like, what are the factors to decide if we want to start in the neck and the shoulder. This one, I want to show you what can help you decide if you want to start in the forearm and the wrist. One is definitely going to be trauma or not. So if I have a person presenting with carpal tunnel like syndrome symptoms and they've had a history of elbow issues, forearm issues, wrist issues, trauma, accidents like that, I'm going to think more and more that I might need to start there. Also, just history of like tightness, issues in the wrist or the hand, and pain throughout. That's going to pick up a lot as well. Like, how long has it been going on? How long have they been feeling it? Also want to know their past and current sport activities. Like, were they like a baseball player? Are they a volleyball player? Are they someone that used one side more than the other? A lot of overuse in that elbow and the wrist. And then lastly, just their current load factors in their job. Are they a manual laborer that uses that all the time? Are they stuck on a computer typing all day using a mouse? Those really help me understand that that's when I'm going to want to start in the forearm and the wrist based off of those history questions. It's going to give me a really good idea that I need to start there. All right, so there's three areas that I really like to address when I'm treating the carpal tunnel, knowing for sure that I need to start in the forearm and wrist. The first area is going to be at the pronator teres. And you can see here in the diagram, it kind of comes over the medial part of the forearm and kind of wraps around through there. And the median nerve actually pierces right through there. So in order to treat that area effectively, what I actually like to use is an instrument. So I have this instrument here, and it's got this round flat edge here, and then it's got this pointed edge as well. I like to use this area as well because it really helps me get in there and feel where that nerve entrapment is as well. And with the instrument, it's really good for about, I'd say, half an inch to 3/4 of an inch in getting in there. And what I like to do is I put that in a full flex position, and I even pull back on the fingers as well. And then what I do is I sink in and I pull tension across there. I usually never do any more than about 7 to 10 treatment passes on that area because it is sensitive. A lot of instrument-based treatments, they go in and they really beat the hell out of the area. And they do a lot of damage to healthy tissue. I want to see that it gets a little bit of redness. That's an inflammatory response called petechiae, but then I know to stop. I just really like using the instrument because I can feel it. It's very superficial and I know I'm right on it, and open it up. And each time I get a little bit more tension as I open that up each time. The next area where I do find a lot of entrapments of the median nerve is going to be just below the pronator teres. You can see this in the diagram here, is the flexor digitorum superficialis. Now, the problem for this area is it's pretty deep, so it's hard to get with the instrument. Like I said, the instrument's really good for about half an inch to 3/4 of an inch. This one, I actually have to use my hands. So what I do is I go in there and I palpate in that area. And when I'm palpating in that area, what I'm feeling for when there's a nerve entrapment, it's very hypertonic and very focused at that area. And that's where that nerve entrapment occurs. So when nerves are healthy, they got a little bit of extra slack and wiggle to them. That doesn't there. So basically what I do is I find it just there, and then I go just a little bit inferior, maybe like 1/4 of an inch down. And then what I go in is I set some depth by sinking in with my thumb. I back out a little bit, then I set some tension right into it. And as I do that, I have the client flex that forearm and go through, and then I'm pulling these second and third fingers down to me. It's called internal slide, where that nerve comes to me. Now, with a manual based treatment, I really only like to do about 5 to 7 passes on that area because it's a little more tender. It really ramps up that tension. They're going to feel it a lot more down in the hand as well. I never go any further than that because I want to get an effective treatment dose. And the last area where I find a lot of carpal tunnel entrapment of the median nerve is going to be actually right in the carpal tunnel. It's a ligament that goes right across here. You can see it in the diagram as well. And for this one, I actually like to use the point here. It's not like a jagged point, but it's enough where I can get in there and break down that entrapment of that nerve right around that ligament. Now, this area, since it's a ligament, we can actually treat it a little bit more aggressively than just the muscle because there's not a lot of blood vessels and things there that can get damaged. So I'll usually get in there and get about 15 to 20 treatment passes on it, and that'll get more of an effective dose as well, and that really frees it up. But usually if I have a forearm, elbow, wrist problem, I do like to start a little bit higher and clean up as much as that nerve as possible, then work my way down. I feel like most carpal tunnel protocols have it backwards. They start all the way down at the wrist and never address anything going up. This is one where, like I said, if you have confirmed trauma, repetitive use, maybe played a very active sport, you're going to want to treat these areas first. But most of the time, I'm actually treating the neck and the shoulder. But in some cases, you might see this as well. That's why I wanted to make this video, to educate you a little bit better. So that's all I got for you in the video. You can do me a solid and help spread this material. You can share any insights you might have gotten in the comment sections below. You can share this with other providers that you know it might help. And lastly, you can go and download our free training modules and really get in the idea of thinking critically, figuring out problems, becoming a solutions provider, treating better and faster than anyone else out there, and getting long-lasting results. The link to do that is wherever you're consuming this material. I appreciate you guys watching, and I'll see you on the next one. Bye.